Hello everyone. Today we're diving into a crucial topic in mental health, bipolar disorder. Mental health is a very important part of overall well-being, yet misunderstandings and myths often surround it. We aim to shed light on this complex condition, helping to foster understanding and empathy. Bipolar disorder affects countless individuals globally, and its impact goes beyond the individual, touching families, friends, and communities. Understanding its symptoms is key to recognizing it in ourselves and others. Before we get started, it's important to remember that this video is for educational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. If you or someone you know is struggling with symptoms of bipolar disorder, we strongly encourage seeking help from a healthcare professional. With that said, let's explore the 8 most common symptoms of bipolar disorder to better understand this condition and the ways it manifests. Let's begin with one of the most characteristic symptoms of bipolar disorder: mood swings. This isn't just about feeling happy one moment and sad the next. We're talking about intense emotional states that can be overwhelming and significantly impact a person's life. Individuals with bipolar disorder experience extreme mood swings. These aren't just ordinary mood changes, they are intense and can last for days, weeks, or even months. On one end of the spectrum, we have manic episodes. During a manic phase, a person might feel an unusual level of energy and euphoria. They might be extremely talkative, have a reduced need for sleep, and show heightened activity levels. Some describe this phase as feeling on top of the world. On the other end, there are depressive episodes. This is where the person may feel deep sadness, hopelessness, and a loss of interest in activities they usually enjoy. It's a profound low that's more intense than just feeling blue. It's important to understand that these mood swings are not something people with bipolar disorder can simply snap out of. They are intense and can lead to significant disruptions in their life, including their work, relationships, and overall well-being. Recognizing these mood swings as symptoms of bipolar disorder is the first step towards understanding and support. It's not about labeling someone as just moody, it's about recognizing the complexity of their experiences and showing empathy. Now let's delve deeper into one side of these mood swings: mania. Manic episodes are a key aspect of bipolar disorder and can be both confusing and challenging to recognize and understand. A manic episode isn't just about feeling extremely happy or energetic. It's a period of unusually intense activity, energy, and euphoria that goes beyond normal happiness. It's like being in a high-speed mode where everything feels amplified. During a manic episode, a person might experience a significant increase in energy and activity levels. They might feel an intense sense of well-being or euphoria, often described as feeling invincible. But it's more than just a good mood. It's an extreme state that can lead to impulsive or reckless behavior. Another common symptom is a reduced need for sleep. Someone experiencing mania might go for days with very little or no sleep and still feel extremely energetic. This lack of sleep doesn't lead to the typical tiredness or fatigue one would expect. It's also important to note that during manic episodes, people might engage in unusual behaviors. This can include impulsive decisions, spending sprees, or even engaging in risky activities. These actions are not just out of character, they can have serious long-term consequences. Understanding mania in the context of bipolar disorder is crucial. It helps us see why someone might act in ways that are difficult to comprehend. Recognizing these signs not only aids in getting the right help, but also provides the necessary support and empathy. After discussing mania, let's shift our focus to the other critical aspect of bipolar disorder: depressive episodes. This is the phase where the pendulum swings to the other extreme, marked by profound and persistent feelings of sadness and despair. Depressive episodes in bipolar disorder aren't just about feeling down or sad. They involve deep, persistent feelings of sadness and hopelessness. It's much more severe than life's typical ups and downs. During a depressive episode, an individual might experience a significant loss of interest in activities they usually enjoy. This isn't just about not feeling like doing something, it's a profound disconnection from pleasure and motivation. People in this phase often describe a sense of emptiness or despair. They might struggle with feelings of worthlessness or excessive guilt, even over small matters. It's a heavy emotional burden that can feel overwhelming. Sleep disturbances are also common, either sleeping too much or experiencing insomnia. Similarly, there can be changes in appetite, either loss of appetite or overeating. These physical changes are reflections of the inner emotional turmoil. It's crucial to recognize these symptoms not as mere sadness, but as serious signs of a depressive episode in bipolar disorder. Understanding and acknowledging these experiences are vital first steps in seeking help and supporting those who are struggling. Another significant symptom of bipolar disorder, often overlooked, is irritability. This isn't just about occasionally getting annoyed or frustrated. In the context of bipolar disorder, irritability can be intense and pervasive, impacting many aspects of a person's life. Irritability in bipolar disorder can manifest during both manic and depressive episodes, but it presents differently in each phase. During a manic episode, irritability can appear as restlessness or impatience. People might overreact to small annoyances, showing anger or agitation that seems disproportionate to the situation. This can lead to conflicts in personal and professional relationships. In a depressive episode, this irritability can be more inwardly directed. It might manifest as being easily upset, tearful, or short-tempered over seemingly minor issues. It's a state of emotional hypersensitivity where everything can feel overwhelming. It's important to recognize that this irritability is not a character flaw or a deliberate reaction. It's a symptom of the underlying disorder. It can be distressing for the individual experiencing it, as they might feel out of control or guilty for their reactions. Understanding that irritability can be a symptom of bipolar disorder helps in approaching it with empathy and support, rather than judgment. Recognizing it as a part of the disorder can be crucial in seeking appropriate treatment and helping individuals manage their symptoms more effectively. Moving on, let's talk about a symptom that significantly affects daily life in bipolar disorder: changes in sleep patterns. Sleep is crucial for our health and well-being, and in bipolar disorder, it's often one of the first things to be disrupted. Individuals with bipolar disorder may experience significant changes in their sleep patterns. These changes are more than just an occasional restless night. They're often extreme and can substantially impact daily functioning. During manic episodes, there's often a reduced need for sleep. Someone might feel fully energized after just a few hours of sleep, or even go without sleep for long periods without feeling tired. This lack of sleep, however, doesn't mean their body doesn't need rest. It's a part of the manic phase. Conversely, during depressive episodes, the opposite can happen. A person might find themselves sleeping excessively, struggling to get out of bed, and feeling constantly tired. This isn't just about catching up on lost sleep, it's a symptom of the depressive phase. These changes in sleep patterns can be distressing and exacerbate other symptoms of bipolar disorder. Poor sleep can affect mood, judgment, and physical health. It's a cyclical problem where sleep disruption can worsen the mood swings, and the mood swings, in turn, can further disrupt sleep. Recognizing and addressing sleep disturbances is an important part of managing bipolar disorder. Whether it's seeking professional help, practicing good sleep hygiene, or using therapeutic interventions, addressing sleep issues is crucial for overall treatment and well-being. Another key aspect of bipolar disorder is the fluctuation in activity levels. This isn't just about having a busy day or feeling a bit lazy. We're talking about significant shifts that swing from one extreme to another, from lethargy to hyperactivity. These changes in activity levels are closely linked to the manic and depressive phases of bipolar disorder. They can be dramatic and impact various aspects of life, including work, relationships, and personal well-being. During a manic phase, a person might experience hyperactivity. This means they're not just active, they're excessively active. They may engage in multiple projects, feel a surge of creativity, or exhibit restlessness, making it hard to sit still. This hyperactivity often goes hand in hand with the reduced need for sleep we discussed earlier. On the flip side, during a depressive episode, there's often a significant drop in activity levels. This can manifest as lethargy or an overwhelming lack of energy. Tasks that were once easy or enjoyable can feel insurmountable. It's not just physical fatigue. There's also a mental component where motivation and the drive to engage in activities diminish greatly. It's important to understand that these fluctuations are not a choice. They are symptoms of the disorder. For someone with bipolar disorder, these shifts can be frustrating and confusing, as they might not reflect the person's true intentions or desires. Acknowledging these changes in activity levels is crucial for understanding bipolar disorder. It helps identify the phase a person might be in and provides the appropriate support and treatment. Whether it's finding strategies to manage hyperactivity or ways to cope with lethargy, understanding these shifts in activity levels is key. Let's now turn our attention to a less obvious but equally impactful symptom of bipolar disorder: difficulty concentrating. This challenge often flies under the radar but significantly affects the daily lives of those with the disorder. Individuals with bipolar disorder may find it hard to focus on tasks, whether they're at work, school, or even in casual settings. This difficulty isn't just a momentary distraction, it can be a persistent struggle that affects various aspects of life. During manic phases, the flood of thoughts and ideas can be overwhelming. This can make it hard to stay on track or complete tasks. The mind may jump from one idea to another, making it difficult to focus on one thing at a time. In contrast, during depressive episodes, it's not just the lack of energy that's a problem. There's also a mental fog, a kind of paralysis of decision-making and focus. Simple decisions can feel monumental, and concentrating on tasks can feel like wading through molasses. This difficulty with concentration and decision-making can be frustrating and often misunderstood as laziness or lack of effort. But it's important to recognize that these are symptoms of the disorder, not reflections of a person's character or desire. Another critical aspect we need to discuss regarding bipolar disorder is the tendency for impulsive and risk-taking behaviors, particularly during manic episodes. This symptom can have profound implications for both the individual and their loved ones. During manic episodes, the usual checks and balances in the mind that govern decision-making can become less effective. This can lead to impulsive actions without fully considering the consequences. Impulsivity in this context can manifest in various ways. It might be sudden, extravagant spending sprees, making rash decisions in personal or professional life, or engaging in risky behaviors that one would normally avoid, like reckless driving or substance misuse. It's not just about seeking thrills or being adventurous. These behaviors can have serious, sometimes life-altering consequences. They often reflect an underlying struggle with control during these high-energy phases of the disorder. It's crucial to understand that these behaviors are symptomatic of the disorder during manic phases. They are not deliberate choices or moral failings. We hope this video has given you a deeper understanding of this complex condition and its varied symptoms. Remember, bipolar disorder affects individuals in different ways, and what we've covered today are some of the more common symptoms. Each person's experience with the disorder is unique. If you or someone you know is showing signs of bipolar disorder, the importance of seeking professional help cannot be understated. Bipolar disorder is a manageable condition with the right treatment and support. Thank you for watching. Your awareness and willingness to learn about mental health issues make a significant difference. Let's continue to support each other and spread understanding. If you found this video helpful, please consider liking and subscribing for more content. Take care of your mental health, and remember, you're not alone on this journey.